Taking centre stage again, the NHS has so far and perhaps predictably had a prominent role in this election campaign. Boris Johnson has promised special NHS visas for foreign staff. Jeremy Corbyn has accused him of putting the NHS up for sale, and Labour's now upped the ante, pledging big money for the service.
With a Labour government, there will be 26 billion extra in real terms for our NHS, 40 billion extra in cash terms. There will be a credible plan for more nurses, more midwives, more allied health professionals and practitioners.
Last year, it was the Conservatives who announced an annual £20 billion boost to the NHS, taking its budget to more than £149 billion by 2023. Labour have now promised to increase that to almost £155 billion, outspending the Tories by £6 billion in real terms. It will recruit more staff, improve mental health care and invest in facilities, and will pay for it by taxing companies and higher earners. But remember this.
The next Labour government will reduce the average full-time working week to 32 hours within the next decade.
One of Labour's flagship policies is to reduce working hours, something the Tories say will suck up any extra cash.
Labour's plans for a 4-day week would totally undermine the economy, but also a 4-day week in the NHS would undermine the provision of services, it would make it harder to get access, it would mean it would cost more, and it completely wipes out any promise of increased funding.
Surely all that extra money you're announcing will go on paying extra staff to cover those members of staff who are working fewer hours.
This is a 10-year programme, and we're going to take people with us. It will be done just as every other improvement in the workforce and in our working lives and our public services. It will be done by building a consensus in negotiations.
The Liberal Democrats are yet to publish detailed plans on the NHS, though they have said they'll raise £7 billion a year by increasing income tax to fund better mental health care and public health services. But analysts fear all parties are missing one crucial point.
It's all very well to make commitments throughout the election period on, improving waiting time standards and all kinds of things that you can do in the NHS, but you can't actually deliver any of them if you don't have a workforce in place. So we really need to see a workforce strategy.
The winter crisis could be the worst ever for the NHS this year. Whoever wins the election then will be under pressure to transform it from day one. Emily Morgan, News at 10.